Hey, what's up, everybody? Welcome back to Mad Medicine. In this video, we're going to be discussing Tourette Syndrome. Now, as always, don't forget to like, comment, and subscribe to the channel if you guys like these USMLE Step 1 videos. And let's begin. So, Tourette Syndrome. I'm pretty sure a lot of you guys know what Tourette Syndrome already is, especially if you watch degenerate shows like South Park or Family Guy. You've probably seen some version of Tourette Syndrome. Now, although I'm laughing, this is a very serious disorder and a lot of people suffer from it, so I don't want to take away from, the seriousness of this illness. And with that being said, let's actually talk about the illness. Tourette syndrome is a disorder that involves repetitive movements or unwanted sounds, tics. Now, this can't be easily controlled, and that's very important to understand. Well, all these movements and these unwanted sounds or these tics are going to be very difficult for patients who suffer with Tourette syndrome to control. They're not going to be able to contain them within themselves, and they get this urge to release the noise or the motion, the movement that they have to do. Now, typically, this is going to show up between ages 2 to 15, but the average is usually 6 to 7 years of age. Now, the hallmark of this is recurrent motor and verbal tics. Now, this is very important, and that's why I wrote this in red, and I'm also going to write high yield as fuck for you to realize that this is pretty important when it comes to Tourette syndrome. And the reason why this is important is because if a patient only presents with motor or only presents with verbal tics, they're going to have something called chronic tic disorder. Now, I'm not going to make a whole video about this. It's kind of very similar to Tourette syndrome. But the reason I'm including this is because when I was studying for Step 1, I got a question that asked me about a patient who presented with simply verbal tics. That's all they had. They were unable to contain the noises that they were making. And unknowingly, I put Tourette syndrome because I assumed it was a patient with Tourette's. However, it was actually chronic tic disorder. So if it's only one, if it's only motor, or if it's only verbal tics, it's chronic tic disorder. If it's both, it's going to be Tourette syndrome. Now, Tourette syndrome is usually presents more so in males than it does in females. 3 to 4 times more so in males than in females. So I just want to write this right here so you guys have a better understanding. So there's a symbol for a male, and this often occurs in males more so than females. And finally, it commonly exists with a lot of other conditions, 2 of which that are very important are ADHD and OCD. Now, 60% of Tourette syndrome patients have ADHD, and 30% of them will have OCD. So when we do talk about the classic presentation of Tourette syndrome, we're going to discuss this a little, but just so you know, a lot of times in a question stem or when it comes to the actual exam itself, they may present a case with chronic tics and ADHD or OCD to kind of throw you off. But it's normal to have these conditions coexisting with Tourette syndrome. So, Tourette syndrome has hallmark motor tics and phonic tics. But when it comes to motor tics, it's really important to understand the types of motor tics that can occur. And I put this GIF right here to help you realize that this right here is a motor tic, right? The guy can't control his own hand, and he kind of has to relieve the movement. Now, there are simple motor tics such as blinking, nose sniffing, neck twitching, or jerking of the extremities. But then there are also complex motor tics like hitting, jumping, or shaking. And this right here would be a very complex motor tic because it takes a lot of neurons and muscle movement and, brain coordination to move your hand from one position to another position to hit yourself, right? So that is an example of a complex motor tic. Now, when it comes to the phonic tics or the verbal tics, they could be simple vocal tics such as grunting, coughing, or clearing their throat, but they could also have complex vocal tics like words or phrases. And one very well-known thing about Tourette's is that some patients will have complex vocal or complex phonic tics where they use obscene language. And there's a word for that, of course, and that's called coprolalia. Coprolalia is when they use obscene language as their phonic tic. So they may, yell the F word, or just say something like that. But just so you know, this only is found in about 40% of the patients. It's not super common, and it doesn't occur in majority of the cases. Now, when it comes to Tourette syndrome, diagnosing Tourette syndrome is pretty important, and it's very easy for test makers to create a question that can trick you very quickly. So when it comes to Tourette syndrome, I would highly recommend you guys understand how to diagnose the diagnostic criteria, because you don't want to get tripped up. So first of all, this has to be diagnosed before the age of 18. Now, like I said, it usually presents around 6 to 7 years of age, but for diagnosis, it has to occur before 18 years. The tic must be present for at least 1 year without a no tic-free period that lasts more than 3 months. So you can't have more than 3 months go by without any sort of tic occurring. You also have to have multiple motor tics and one or more phonic tics. So the and is very important. Otherwise, it becomes chronic tic disorder. Now, keep in mind, the tics don't have to be constant. They can vary in frequency. They don't have to be continuous as well. They're usually sudden, they're usually rapid, and they have to obviously recur because of what we just said right here. They have to be occurring constantly. And then the tics may occur many times a day, and they have to be unexplained. And this is very important. The unexplained portion is very important, because if a patient is abusing substances, or if there is a pre-existing condition that's causing this, like say if they have a brain tumor and it's causing their Broca's area or their Wernicke's area to be affected, that's causing them to have more phonic tics, then you can't say it's a tic disorder. You can't say it's Tourette syndrome. You have to rule out substance abuse and pre-existing conditions to say that it is Tourette syndrome. So when it comes to a classic presentation, it's very simple, in my opinion. It's going to be a 12 to 11-year-old male. Remember, usually occurs in males. Of course, you can be given a female, but most likely they're going to give it to you in a male, who's brought to your clinic by their parents, and the parents have noticed some odd behavior that's been happening for the past few years. Now, one thing that's important is, I know I wrote parents right here, but it could also be because of the parents or the teacher. A lot of times, kids who are 6 or 7 years old are going to school, and the teachers start noticing, hey, there's something that's, not normal happening. He's making some noises. He's grunting randomly and in inappropriate areas, times. So they might bring that to the notice of the parents. The patient might yell out certain words or phrases, and usually it occurs at odd times. So there might be quiet time, it might be nap time, and the patient is yelling or just screaming. And they have to also have some sort of a motor tic, right? So they could be sniffling for an extended period of time. And then finally, the most important thing is that there's no history of substance abuse or other medical condition. The patient is otherwise healthy. This will clue you to This will clue you to Tourette syndrome rather than chronic tic disorder. When it comes to treatment of Tourette syndrome, the very first thing you want to try is psychoeducation and cognitive behavioral therapy. But if, of course, that doesn't work, you can always go on to high-potency antipsychotics like haloperidol, flufenazine, risperidone, and pimazole. Now, keep in mind that these are usually reserved for very extreme cases of Tourette's, for intractable or distressing tics, pretty much, things that it's affecting their quality of life. And a lot of times antipsychotics are given for schizophrenia, but in this case, you're going to give a lower dosage for Tourette syndrome than you would for schizophrenia. So those side effects that we know for schizophrenia that could happen with these drugs most likely will not occur simply because of the low dosage. So you shouldn't be worried about side effects being present in a case of Tourette syndrome on the boards. Just so you can remember, these are dopamine blockers. They block the postsynaptic D2 receptors in our brain. So that's what you can give for very extreme cases of Tourette syndrome. You can also give tetrabenazine. Tetrabenazine is a dopamine depletion. It causes a dopamine depletion, by inhibiting VMAT2. And what ends up happening is this blocks the uptake of dopamine in the presynaptic neurons. And at the end of the day, this leads to less dopamine storage and release overall. The main point is in Tourette syndrome, you want to try to decrease dopamine. Let's write that down. So the two ways you can do it is by giving a D2 receptor blocker, or you can decrease VMAT2, which causes a decrease in the reuptake of dopamine. So that's the main two mechanisms of treatment. And finally, if none of this works, you can also give alpha-2 agonists like guanfacine and clonidine, or atypical antipsychotics may also be used. Normally, within the scope of these three, a patient with Tourette syndrome can be managed. And with that being said, ladies and gentlemen, thank you so much for watching this episode or this video on Tourette syndrome. If you guys like what we're doing, don't forget to like, comment, and subscribe to the channel. We're going to be posting regular Step 1, USMLE Step 1 videos. So with that being said, go ahead and go on to the next video.